Diabetic retinopathy. Diabetic retinopathy is a disorder of the retina, which is the light-sensitive tissue at the back of your eye. Full Body Health, going to teach you what retinopathy is as well as some ways that it can affect your vision. If you're suffering from this condition, or know someone who does, please watch this video until the end for more information. Diabetic retinopathy is a disease that results from damage to the small blood vessels in the retina, caused by diabetes mellitus, a condition in which blood glucose, sugar, levels are above normal. Diabetic retinopathy is by far the most common form of this disease. What happens in diabetes that causes retinopathy? Your body naturally produces a hormone called insulin, which enables your cells to absorb glucose from your bloodstream for use as energy. In people with diabetes, their pancreas doesn't produce enough insulin, or their cells cannot effectively use it, resulting in a condition known as insulin resistance. Glucose accumulates in the blood and is not used properly by cells throughout your body. Excess sugar can damage small blood vessels, and for people with diabetes, it often affects those tiny vessels that nourish the retina. When this happens, fluid leaks into the retina and separates the light-sensitive cells from their blood supply, leading to vision loss. Symptoms of diabetic retinopathy. Diabetic retinopathy usually first affects your peripheral or side vision. You may not notice it at first, but as more blood vessels are damaged, you will begin to have trouble reading and driving. Other early signs include cloudy swelling in some areas of your retina, which appear as small dark dots. If the retina detaches from its underlying tissue, fluid leaks into the space between them, resulting in new blind spots, or a total loss of some or all vision, depending on which layer has detached. People who have had diabetes for an average of 15 years will develop diabetic retinopathy. Treatment of diabetic retinopathy. So far, no treatment can completely restore your vision once it's been damaged by diabetic retinopathy. But with early detection and proper care, you may be able to stop the progression of the disease, or even decrease its severity. Your doctor will prescribe medication, such as eye drops, that increases the amount of fluid within your eyes, making them thicker and heavier, which decreases abnormal leakage from blood vessels under your retina. Laser surgery can also help reduce fluid buildup behind your retina. These treatments slow, but do not stop, vision loss in most patients who have developed diabetic retinopathy. The longer you have diabetes, the greater your risk of developing diabetic retinopathy and vision loss. That is why it is crucial you get your blood sugar levels under control to prevent any long-term damage to your eyesight. If you have diabetic retinopathy, please like this video, share your thoughts in the comment section, and subscribe to Full Body Health for more health information. Thanks for watching.